Hi, I'm Andrew with VATA, and today I want to go over one of our new products. This is our Penny Pediatric Intraosseous leg. And so today I'm going to go over a couple of different things on the product with you. The first thing I'm going to do is we're going to unbox it, show what comes with the product, and then I want to go through the entire setup and the use process so you can see exactly how the product is used, and it'll kind of show you exactly what to do once you purchase it. And then lastly, I'll go over some of the questions that I know we're going to get on this product going forward, as well as different care instructions, and this kind of are things that transfer from not only this product, but across some of our other products as well. So first thing is, it's going to come in the box here. This is how it's going to ship. It's also going to be a storage case. It has little areas for each one of the items that comes with it. So first product part of it is going to be the actual leg. This leg is molded off of a 3.5-year-old. So it's got a lot of the details there. You've got all the way from the foot to just above the knee into the mid-thigh area. Then it's going to come with 2 sets of 5 bones. The first one is going to be the 5-pack of the femurs, and the second will be the 5-pack of the tibia here. It'll also come with 2 fluid bags. We're going to fill those, and this is going to be used to help you do the infusion of the product. There are 2 packs of wax that will come with it, and that's going to be used to reseal it after each one of your accesses. It's also going to come with a syringe and a small adapter. This is going to be used again in the setup and the filling of the bones as well as the blood bags. And then lastly, it's going to come with a 8-ounce bottle of our blood. This is going to be used for not only your initial use of the product, but it should last you for several uses, and at least for this first set of bones that come with the product as well. All right, now that we have the product unpacked and we have all of our parts, we're going to want to go through and get it set up and ready for use. In the box, there was 5 tibia and 5 femur. There is also a tibia and a femur inside the leg pre-installed. Both of these bones are going to be dry, so in order to use the product, we're going to need to fill them with blood first. So to do that, first thing we're going to want to do, or the easiest way, is going to be to actually just remove them from the model. To do that, just pull the bone out. There's a tube track in there. We're going to want to remove the tube from there, and then just pass the end of the connector through the opening in the proximal side of the leg. Then once we have our tibia and our femur, we can set those down. We're going to want to take that adapter that came with it and attach that to the syringe. Like I said before, this is going to do a couple of things. One, it's going to make actually the connection to the tubing coming from the leg. It's going to allow us to connect those. It's also going to help us get the blood out of that blood bottle that came with the product. So go into your blood, fill the included syringe all the way up with blood. You're going to need a decent amount to fill the 2 different bones. Now that you have your syringe filled with blood, you're going to want to start by filling the tibia. To do that, loosen the cap here just slightly, and that's just going to allow some air to come out. Attach the adapter to the tubing, and then make sure that the cap is pointed up. You want that to be the highest point to let all of the air get out. Slowly start to infuse in the blood, and you're going to go just until you see a little bit of blood come out of the top there, and then you're going to stop with your infusion. So we'll go ahead and stop, and then any excess, we're just going to give that a little wipe. We're going to close our pinch clamp and then disconnect our tubing. You're now going to want to repeat that same process with the femur. Again, loosen the cap slightly, make sure that's pointed up, attach our tubing to the syringe with the blood, slowly infuse, making sure that cap is pointed up, allowing all the air to escape. And then as we slowly infuse, get just a little drop of blood up there. We're going to tighten that down. Close our pinch clamp off. And then disconnect our syringe. And wipe off any excess blood on the bone there. Now that both your bones are filled, you're ready to put them into the model and start to use it. With the bones, you're going to see here, and this is going to be helpful, there's going to be an F on the femur, and there's going to be a T on the tibia. That's going to correspond to the same letters inside the part. That's just going to help you kind of set it up, especially as the model is new to you. You're going to want to start with the tibia, and you can lay that down into the model, And as you go ahead and push in the tubing, you're gonna wanna make sure that goes all the way down into the recessed area for the tube. And just again, slowly push it in there, pull the skin back if you need to a little bit, and it should slide right in. And then put the femur in. Femur is gonna be a little bit easier. It's just gonna set right in with the tubing going through up by the knee area. Now that both of the bones are in there, you can place the skin on top of the model, and now it's pretty close to being ready to use. The last thing we're gonna want to do is taking our syringe, we can fill it back up with blood, get all the extra off, and actually disconnect that tubing. Attach our syringe directly to our blood bags with the stopcock being open, and then infuse in. Comes with a 30 ml syringe. If you do 30 mils, that should be enough. You don't want this blood bag to be really full because you are gonna be filling it up when you flush the model. So that should be enough to help you get a blood return. Disconnect your syringe, close off your stopcock, and then repeat that process with your second blood bag. After both of your blood bags have been filled, you're gonna wanna attach them to the tubing for the two different bones. So each bone is gonna have its own bag. So we can start here by attaching our tibia bone. Once it's attached, do the same thing with the bone for the femur, or the tubing for the femur. Then we can open both of the stopcocks, as well as the pinch clamps, and the model is now gonna be ready for use. All right, now that we have our blood in both the tibia and the femur, as well as in both the blood bags, the model is ready to be used. This is the setup in order to use it as a wet model. It can also be used as a dry model, so you don't have to put the blood in to all these items. It's all gonna depend on how much time you have and what you're trying to get done during your training or your demo. So we can access in both the proximal tibia as well as the distal femur. For this one, we're gonna go ahead and access the distal femur. Like I mentioned before, in the skin insert here, you do have a patella in here that can be palpated. So that's gonna help you determine the best site to access. So we're gonna go ahead and feel for the patella, using that to determine our landmarks and our best access site. Place our device in until we hit the bone, and then drill until we feel that loss in resistance. Once we've felt that drop in resistance, we can go ahead and remove our drill and get ready to do an infusion. To do that, we can go ahead and place our tube set onto the needle there, attach our syringe. I do have some water or saline in this. That's gonna be the best thing to use. After you've accessed, you can aspirate and see if you get that blood or that marrow return. Now that we do have it, we do know that we've accessed the bone, we're in, and everything is clear. We can go ahead and do our rapid flush, showing that everything is clear and we're now ready to do our main infusion. After you're done with your access, you can go ahead and remove everything. So we can remove our tube set. Remove out our accessing needle there. Now you're gonna wanna pull the skin off of the model and set it aside. And we are gonna have a hole in the bone. That's gonna be from the access we just did. In order to fill that, if we're using it as a wet model and prevent leaking on our next access, we're gonna take out the wax that was provided. Take a small ball of that wax, just roll it in your fingers just a little bit, helps it become more pliable. Find our access site, push that wax into the site, that's gonna plug it. We can use a paper towel to wipe off anything that has leaked. And after we've done that, we're gonna place our skin right back on top. And now the model is gonna be ready for your next use. One of the other things you are gonna notice on this model is that the bones are gonna have a limited amount of accessing on each one. What that's gonna mean is after you've accessed it 6 to 10 times, the bone is gonna kind of run out of real estate in order for you to access. When that becomes the case, all you're gonna do is lift the bone up with the femur, rotate it 180 degrees, set it right back down, and the other side is gonna be the exact same. So the bone is a mirrored image of itself, and that's gonna allow you a fresh side of the bone to access, and again, another 6 to 10 accesses before you're gonna need to replace that with one of the additional bones that came with the model. That is gonna be the exact same process for the tibia. Again, after you access, put in your wax. Once this side is used up, lift it, rotate 180 degrees, and press it right back down, making sure that the tube set is pressed all the way in, and the model is gonna be ready to use when you put your skin back on top. After you've done your accessing, you're done with your training, it's now gonna be time to store the model until you use it next. If you're gonna be storing the model for more than a few weeks, we recommend draining everything, putting it away dry and clean. That is just gonna leave the model in the best condition, it's gonna prevent mold from growing in it, and it's gonna make sure that next time you get it out, it's clean and ready to be used. So in order to do that, we're gonna kind of do the setup process just in reverse. First thing we can do is we kind of just remove our skin, make sure everything in here is clean. If it's not, give it a good wipe. Take your blood bags, close the stopcock on both of them. Close the pinch clamps on both of your bones. This is just gonna prevent leaking as you're putting things away. Disconnect the bones from the blood bag, and then go ahead and pull each one of those bones back through the leg. And now, depending on if the bones are used up and there's no more room for additional accessing, you can go ahead and dispose of those. If there is room for additional accessing and you are gonna be using the model sometime longer than a couple of weeks out, we are gonna wanna drain the blood from the bones. Take your bone, open up your pinch clamp. For this, I'm gonna set it into here. This will be the same process in a sink. Go ahead and open up that cap. And after you've opened it enough, you're gonna see the blood just come right out. Once you've done that, shake out any last little bit of it, wipe it off, go ahead and set that aside, and repeat that exact same process with the next bone. Again, opening the pinch clamp, putting that tube inside the blood bottle or into a sink, unscrewing the cap until you see all of the fluid that's inside the bone drain out. And give it that little bit of a shake there, make sure everything's coming out of that tube. Then I would recommend actually flushing this with saline or distilled water if it is gonna be stored for a long period of time. That's just gonna make sure it's really clean. Leave the pinch clamp open, leave the vent cap over here, leave that loosened. That's gonna allow air to flow through the model, allow everything to dry out fully. Just like we did with the bones, we're gonna wanna drain the fluid out of here. For this, I would recommend doing it in the sink just because sometimes this is gonna be diluted or there may be additional contamination depending on what you infused in. But for this purpose, I will do it into the bottle because I don't have a sink here. So in order to do the draining though, just open up that stopcock, place it into your sink, allow all the fluid to drain out. Once it's mostly drained, you're gonna wanna go ahead and maybe flush this with distilled water or saline. That's just gonna prevent it from growing mold over time. And then when you do go ahead and store it with the stopcock open. That's gonna allow everything to evaporate and for these to dry out and be ready for use next time. Then you can go ahead and once all your bones are dried, put them back into the model, put your skin back on the model, put it back into the storage box, and again, it's gonna be ready next time you go to use the model. Now that you've used your model for the first time, or maybe you've used it 50 times, either way, there's gonna be certain questions that we know customers are gonna have, and some tips and tricks for using the model to avoid problems. The first one we're gonna go over is just the cleaning of it. We get this question on all of our models across the spectrum. Just like with a lot of our other models, the best way is gonna be soap and water. Just use soap and water on here, wipe it down, and then let it dry. You can wipe it down with a towel, that's gonna get most of the moisture out, and then setting it out to let everything else evaporate off. That's gonna be the best way to keep it clean. You can also use alcohol. We use a lot of rubbing alcohol. It does a great job of cleaning off grease, anything that maybe got on it during your use, adhesive, any of that kind of items, it's gonna remove that from it really well. You're gonna wanna take baby powder, apply it to the model. Once it's completely dry, sprinkle it on lightly, take a non-linting cloth, and then wipe off any excess powder. Another big one is going to be the skin insert. So with the skin insert, this is going to be a consumable part, so you are going to want to replace it. We'll have links at the end of our videos or in the product description on where you can find those products and purchase it. But keep that clean and be gentle with it. That's going to extend the life as much as possible. It is going to need to be replaced, and it's going to last for usually about a 5-pack of the bones. And again, each bone is dual-sided, so that's 10 different bones really. If the skin is not setting correctly, if it's kind of up a little bit, the main cause of that is going to be this tube on the inside. It's going to be the tube from the tibia. It needs to go all the way down in that channel we looked at when we were doing our setup of the product. If the tubing is not pushed down and it is sitting above that channel at all, that's going to actually push up. So if I pull it out just a little bit, that's going to push that skin up, and it's not going to sit correctly. So make sure that that is seated all the way down in that channel. And once you do that, the skin insert is going to sit nice and flush with the skin, and it's going to look really good. Leaking, if there is leaking in here, and again, if you're using it as a wet model, there is going to be some amount of leaking. There's no way around that. But wipe it up after each access and make sure when you're using the wax that you're pressing it all the way into those holes and really getting it in there. You can't push it in too much. So push it in really firmly, and that is going to do a great job of sealing it and preventing leaking on additional accesses. A couple other things with the model. One is going to be, you're only going to want to use the supplied blood or blood you purchase from us. The blood that we have, it's going to be non-staining. It's not going to affect the material at all. If you do use other liquids in the model, it may stain the model, it may damage the model, and it could potentially void a product warranty. Also, if you are using adhesive on here, if you're using the entire process and there is adhesive involved, take those dressings off as soon as you're done with the model. And that's going to prevent the adhesive from sticking long term. If the adhesive does get stuck on here, it will clean off. You're just going to want to use any approved, patient-approved adhesive remover. That should do a great job. You can use isopropyl alcohol. You can also use adhesives that you would purchase at the store, such as Goo Gone. That does a great job on this material. If you do use something like a Goo Gone, it is going to leave a very oily residue behind. Use isopropyl alcohol, give it a really good wipe. You might need to wipe it a couple of times to remove that oily residue. And then, like I said before, you can go ahead and use baby powder to kind of remove that natural tackiness from the material. If there's any other questions that you do have on this model, you can always go to our website. We're going to have product information there, pictures, videos going through the product. You can also call us. We'll be happy to answer any questions you have on this product and then help you, if you do have the product already, get any of the replacement parts that you need in order to keep using the model in the future. Again, thank you for your interest in VATA products, and if you have any questions, just let us know.